Fly like a king. Haya, acha tuione. Toa condom like this. Put in your angalia ndani na nje. Pull like this. This is for oral sex. Uh-huh. 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 Sometimes we must go extra mile. Makofi. Now, at the same point, we want to emphasize why PrEP and PEP is very important. Even if you do condom, you do it with your mouth, you do it anyhow. If you get a condom burst, and I want to show you, men, let us use the right steps for sex. Some people in a hurry. One hand is removing the pant, you are putting the right off, you are closing the door, you are in a hurry. Please, let's use the right protocol and proceed. Because when you push yourself like this, and I like demonstrating this, this is the condom burst. A lot of people ask, why do we have condom burst? Condom will burst when you're in a hurry, when somebody is not well lubricated, a lot of things. When somebody is in panic, and condom will burst. When you have a condom burst, within 72 hours, you will get. But if you have this chain, you have multiple partners, you can to arrange, you can go for PrEP. So we have PrEP and thank you very much, sir, for that golden opportunity. Thank you.
Thank you very much. You ndo makofi mnamtia the king and the queen. So, ladies and gentlemen, mmechangamka kidogo. Now you see, I hope when we're going to talk about the programming, you get the context. Sindio? So Stanley and the Queen, asanteni sana, tumeshukuru. And there's a challenge by the way, wamesema muende kwa booth yao. There's going to be a winner who takes the best selfie with them. So mkitoka hapo mpande huko juu, hapo kwa booth ya NSDCC, mtawapata hapo tu wamekaa kando hivyo, mchukue picha na hao, there's going to be a winner. Kuna ka prize, sindio? Mmesikia. So hapo mkae chanjo. Now, I'd like to officially start. Madam CEO, thank you for joining us. Our esteemed panelists, but more so I want to introduce my co-moderator, Dr. Tom Marwa, who's going to be moderating this session with me. We have a very lively group of panelists, but right now it's my pleasure to introduce Dr. Marwa to say one thing and also then to invite the CEO to make her remarks.
Good morning, everybody. Yes, my name is Tom Marwa. I'm glad to work closely with Max in this particular session to moderate this particular discussion. And I was worried that we were not going to achieve this number because everybody I talked to, they were like, oh, condom and all public health intervention towards HIV. But I'm glad that we have more than enough and the guys are still coming in. So to start us off, I think the first thing will be to Madam CEO to come forward and give an overview of why we are here and why we need to take this narrative seriously. And that will be followed by a discussion by a able panel who will be discussing various issues. And I'm sure from the CEO, there are several areas that she's going to present that the various people in the panel will be talking about. We know there are a couple of gaps, despite condom programming being one of the oldest programming intervention area in HIV. So without much ado, karibu daktari.
Thank you very much. It's very difficult to speak after the king of condoms. I was so scared he was going to call me. And I didn't know if I'm going to become what my label was going to be. You know, every time we speak about condom, I really love looking at the history. So one time I was reading my father's books. My father was a historian, so he used to love history. And so I was, I think, around class 5 there. And there was this big book that he used to love reading. You know, they used to be dark and dirty. I think they were kept for so long. And so I stumbled across condoms, the story of condoms. And somewhere deep in my history, I could remember about a king who had to have the wife use a condom then, because it was believed that his mistresses were dying because his sperm contained scorpions. Do you know that story? Amujui your story? Nani anajua your story ya condoms? You don't know? Have you ever heard of the story? So let me read for you. King Minos of Crete pacified. His wife employed a goat's bladder in the vagina so that the king Minos would not be able to harm her, as his semen was said to contain scorpions and serpents that killed his mistresses. So those were ancient kingdoms. So what condom did they make? What kind of condom do you think they made? Sheepskin. What? Skin. Others said, sheep what? Intestine, motura. Yo, tunafunga naye motura. So what I'm trying to say is that even from that period of time, society was actually wondering, what can we do to stop the deaths? And I'm sure that must have been a certain STI. I even wonder what STI it was, because they knew that if you had sex with that king as a mistress, you will die. So to preserve the wife, the official wife, she decided she will be going to be using something so that she can live there as a king's wife. And I think we have just been demonstrated. She was a very bright woman. And of course, women are always bright. Yeah? So I think the story of condoms in this country is associated with the World Bank Tower program. Sometimes every time we speak about condoms, people say, condoms lienda wapi? Are there condoms? Are there condoms in the country? Hakuna? So, hakuna, ni condoms gani haziko? First of all, we're in agreement that use of condom has been very, very effective in the fight against HIV. We know it provides about 95% protection. And condom is the only single method that has a triple protection for the public health space. It protects against unintended pregnancy, sexually transmitted infections, and also HIV. Look around all technologies that have come. We are yet to get a triple protective tool. So we were in Geneva and we were discussing with Global Fund about combination prevention. And then Dr. Nduku asked, I agree with you, I want to have PrEP, I want to have these sexy things that have come, but I want to know, why is condoms not on this menu? And she asked a question that for us with generalized epidemics, so many people who are living in the HIV high burden countries, share with us the most effective method that we can use if it's not the condom. And everyone in the room kept quiet. So in the country today, we have a need of about 424 million male condoms. And we need to be at about 40 condoms per month per year. You know, wale vijana wako hapa nasema 40. Mmesikia kuna wengine wanagurumisha gari. So the average is calculated from ule anashangaa 40, kuna ule anasema 40 zote. Vijana, munashtuka. So that's the average. But then we are about 14.6. So really, the use itself, even if when they are available, has never really been good. So only 45% of males aged 15 to 49 reported using condom at their last high-risk sex, which means they knew they either had multiple partners or they basically classified that sex as high risk, and only 24% of the females. So what in essence means an average woman from our data has about 2.3, so to compare 2 to 3 partners, sexual partners. And for men, we found 7.4 partners. So when when a country says that about 55% of those acts are unprotected, and for the women, a whole whooping 76%, we have a problem. So we, of course, have been developing policies and talking about we want a total market approach, we want consistent supply and demand, and that is where we are all stuck. We keep saying the issue is condoms are not available. But then the focus area 2 of demand, access, and utilization, we largely don't remember. That's also a bigger problem because our data is not talking about condoms not being available. Even when they are available, the use is so low. So we have an indicator that we must look at. Then the next one, we talk about leadership and coordination. So we want to make condoms become like any other consumer good. And we really want to congratulate the king of condom because he has made the condom story become, yesterday when you walked in, can you imagine when we came in with the PS, we just walked in and I wasn't prepared. And then boom, there was a demonstration. And and we were looking at each other. Oh, no, we never told the PS is going to be the first thing he's going to see from this guy. And he demonstrated the female condom. And of course, the female condom makes you a little bit, when it's being demonstrated, you're like, oh, okay. So I kept saying, my friend, just finish this conversation. But very interesting, when we went to Chit Chat, it was interesting to catch up about that, what he was demonstrating. So it had a high impact. And there's nothing as when the stakeholder who is seated on a seat being able to see the tools that we speak to him when they look like paper. We have been distributing condoms, of course, and we have been putting distribution points across the country. And what we've tried to do is to say, let's have condom in a health sector setting. That has been one of our biggest challenges. And the other challenge is we as a country have a bigger problem. I can tell you, since all of you came here, I don't know how many sexual acts have happened since you came to Mombasa. But I can assure you that a lot of those sexual acts, there was some bill, and that bill may have involved 12 years of Glenfiddich, may have involved some gin, may have involved some, whatever, Tasca, whatever that was bought. But in that equation, there was no condom. And somebody will tell us there were no condoms, but I can tell you that supermarket had condoms, right or wrong. But the perception of a Kenyan is that 300 shillings is a lot of money. But how much is a Glenfiddich? 10,000? 15,000? Yeah. So that same person who walked into that supermarket and bought the Glenfiddich 12 years, 18 years, and whatever, 16 years, you're naivety, so don't worry. They again realize they say the condom was too expensive. And that's another problem. It's a different set of problem. And this sometimes is mistaken when we start talking about funding. Because we say the condom program is heavily funded by donors. We need the 1.1 billion. We have our 800 million resource gap. And that was of 2021. Then we say public sector is the dominant source of condoms at 84%. And then socially marketed condoms at 14%. Angalia commercial sector, 2%. So during one of the devolution conference, I was told there are no condoms. I called a Nakumatt supermarket and I said, condoms zilisha huko. Sema hapana, tuko na condoms. Why? Because the condoms that they're talking about are the ones for 84%. That is the most desirable thing we would want for any country. But we must also agree that the way we designed our HIV program and reproductive health program, we made a miss. From the beginning, condoms should have been looked into as an essential, basic service, commodity. It should have been the way you're talking about septrin. But then we missed the mark. And we then did not put it, even when now you look at the basic packages that you're calculating in NHIF package, amujaweka condom, iko kwa back burner. Why? Because we have not internalized as a tool that actually sort out the entire public health system. So many things. Can you imagine something sorting you gonorrhea, syphilis, pregnancy? The impact of condoms being available everywhere for everyone would be really something that would sort out almost the entire epidemic and would sort out a lot of other issues that we are facing. Nigeria, look at Nigeria. Socially marketed condom 58%, public sector is at 23%, and commercial sector at 19%. Our map currently is inverted. Now that is why we talk about total market approach. At the same time, saying that we cannot have such a huge gap of condoms that are within the public sector, because the people who cannot afford a condom really are quite a number. And some of those condoms, I have seen the cost is so high. Many users of free condoms are willing to pay for condoms. That's something that a study that was done. In Kenya, 53% have ever purchased a condom, but they use regularly the free condoms. Percentage willing to pay price of lowest commercial brand, 93%. Those who would seek to purchase if free condoms were available in Kenya, 70%. But look at the statistics. In Nigeria, that's 60%. Those who are willing to pay is 80% for the commercial one and 70% those who seek to purchase if free condoms are not available. Now the question is, when then the statistics look almost similar, then what happens when then we look at the first one that we had here, where this become inverted? Is it that we lie in our questionnaire? Ama tunasema Wakenya tunajua kusema ile mtu ataka kusikia. Because then if indeed this slide was true, the other one would have been perfect, isn't it? So we have a job to do. We probably need to ask the question you're asking differently so that you can get the right challenge that you're facing. Because unless we understand the challenge in Geneva, and I was talking to young people because 16 years old, they are young people who wakiingia kwa hii gate. Switzerland inaishianga kwa hii gate. Ukiingia hapa tuko Kenya. So 16 year old in Kenya ni mtoto. Marafiki zao wakakuja wakaniambia them they are adults of legal age. But what I found interesting is there was a discussion among these 16-year-olds, and there was a girl who had gotten an STI. And the boy who was in the house was telling me, Can you imagine? Oh my God, it's so sad. They had sex without a condom. Huh? So I'm like, oh, how can they do that? That was so irresponsible. So the young boy was telling me how he thought both the girl and the boy they had sex were completely irresponsible. It is unacceptable. And they got an STI because they don't use a condom. Back to that story, I realized that the agency the young boy was talking about, the conviction that if they decided to have sex at that age, they should have considered a condom, was so deeply ingrained in them that we have missed a mark because, of course, for us, we can't talk about condoms. We are so scared. What will our children say? If they see mine saw condoms the other day, courtesy of John Madenge and lubricant, they were in my bag, they went to remove, and then they came with them in the sit room. Daddy, what is this? What is this? And then Daddy says, so Mwambia. So I said they are condoms. What are they used for? What do you think I said? Sex. Utajua ukikuwa mkubwa. That has been our common answer. Mami utajua ukikuwa nini? Mkubwa. You're hoping that akikuwa mkubwa kidogo atarudia hiyo swali. Ashajua wewe ni muongo. So my daughter, I know she knows. Anything that is about those things, atafute mtu mwingine atamwambia ukweli. Na huyo mtu mwingine atakuwa the peer. That is why the peer education. And that is why we are actually saying, and I like Senator Muma's conversation yesterday, if we can't do it at home, then maybe and which works. For me, it works. When I organize them in a group, aibu inaisha. Because we have to accept you come from communities pali kuna aibu, sindio? So when there are many children, so wako wanakutoa aibu and you can speak to them. No matter, whatever solution you can, including bringing them into a group to communicate, to give the education. Those of you yesterday who may have attended the triple threat conversation and the young girl that was there, I was crying and, my tears were just falling down and I'm like, how can we let down our children like this? What are we doing? And that's the same thing we should feel about condom. It looks like a simple thing, but we need to ask ourselves as adults, why are we failing over and over and over? Thank you very much, and I look forward to the discussion.
Thank you very much, Dr. And actually, you've raised something that today I and Max were discussing over breakfast around messaging for condom for the young people. I think it's high time we start thinking on how we need to package the message for the condom. About a year ago, we did a survey with young people. We wanted to know what is their perception currently about condom use. Actually, if you want to lose them, when you're having a dialogue with them, start talking about condom use. But there is a diplomatic way in terms of programming. When you are designing a program and you want to talk to young people about condom use, remember, right now, what young people want to hear is around issues around pleasurable sex. Am I right, young people who are here? They want to hear how can they have quality sex. And we are seeing young people buying condoms, buying Viagra. Why? Because they have the pleasure. They have this pressure to provide pleasurable sex, from their partner. They're getting a lot of pressure from the girls and from boys that they need to perform. So we are having young people buying. So we are thinking one way of doing this is actually using the pleasurable sex notion. You talk to young people that for you to have pleasurable sex, safe and pleasurable sex, then one element that you need to have in there is condom. So those are some of the issues around programming that we need to really discuss around. Thank you, Dr. very much for your presentation. It has actually sort of shed more light in terms of our discussion in today's session. So issues which are coming out is there's a need of about 424 million condoms against around 190 million condoms which were distributed. That is in 2021. And for female condoms, around 3 million were distributed against the need of 8 million. So there is a huge gap if you look at that. And again, Dr. has raised the issue of around the program relying heavily on external funding, where we use about there is need for about 1.1 billion, and there is a resource gap of around 800 million. And again, that's an area that we need to discuss in this particular forum, see how we can meet that shortfall. Then the other thing that Dr. has raised is that Kenya is using the total market approach, where issues around access, correct condom use, demand for those condoms, among others. So the reason why we are here in this particular session, these are our objective for this session, is to identify critical enablers on condom taxation and the regulatory environment for total market approach. And the other one is to understand what it will take to ensure sustainability of the condom program. Then to understand the business case of condom in preventing HIV, other STIs, and unintended pregnancies. Then lastly, to understand the effect of condom stockouts on the disease burden. So I've talked about those things. And again, Dr. also mentioned that in condom programming, there are three crucial areas. If we want to have a successful and impactful condom programming, number one is to have, some kind of leadership, condom program stewardship. And here we are looking at issues around the leadership, financing, policy, and regulation. Then the other area is condom market development, issues around supply, demand, market analytics. Then the other one is condom market management, issues around equity and sustainability. So with that, having raised that, I think with the panel that we have, I think you can come in front. Karibu, our panelist for today. Welcome. So karibu daktari. There's another seat. Okay, you are. Okay. Thank you very much. These are able panelists. Maybe we can start with an introduction. I know, Daktari, you have introduced yourself. We can start from Daktari, from the extreme end.
Good morning. My name is Dan Okoro from UNFPA, Sexual Reproductive Health Advisor.
A very good morning to you all. My name is Dr. Werimo Pauline from the Pharmacy and Poisons Board.
Good morning, everyone. My name is Dr. Komo, County Director of Health, Homa Bay, and the Chair Caucus of Directors in the country.
So, good morning. My name is Dr. Samuel Kinyanjui, Country Director, AIDS Healthcare Foundation, Kenya.
Good morning. I'm Dr. Peter Kimu, working with the National Treasury Group of Fund.
Thank you very much. So we'll, without much ado, we'll go straight away to, Daktari has mentioned a couple of challenges. One of the areas that emerged was issues around the regulatory and the taxation. Maybe around the regulatory, Daktari, with your experience, what are you currently doing in terms of mitigating some of those challenges?
Thank you very much, Maro. And I think going fast puts the unexpected pressure of having to level the ground with Dr. Maisha having so well taken us down the roadmap. I'm going to start perhaps from a different aspect and just bringing the audience to the fact that sex is a basic human need, and that is according to Maslow's needs for our existence. It's a physiological need. So we are not about to not have sex and to stop having sex. The only thing we can do is see how to do it responsibly. That is very far from my work as a regulator. The Pharmacy and Poisons Board has the mandate of ensuring and supporting quality medical products are availed to the public. And in this case, condoms fall in that category. Now, medical devices, and unlike medicines, we've heard very well Dr. Maisha speaking to the origin or the discussion about condoms. Condoms are not medicines. They're not your paracetamol. They're not your augmentin. That it's something that you'll take or the expectation thereof. Condoms are medical devices, and we define them as such because the way in which they operate to protect against unintended pregnancy as a way of contraception, and also to be able to protect against sexually transmitted diseases, is because they're a barrier method. It prevents a barrier between the person who is the user against the person who is the two partners. In this categorization of a medical device, we apply different regulatory needs, and the Pharmacy and Poisons Board has a risk-based classification method of regulating medical devices. In this way, we have products that are responsible for reproductive health and contraception as Class C medical devices. And in this case, every product that is looking to get importation into the market has to first undergo market authorization. in language understandable, that is to mean that a product must be registered or you must seek authorization to the country before importing it. We employ that regulatory control to ensure that there is safety and to ensure that we can actually look and track the product once it gains the market or once it's in the market. So it's a three-dimension aspect to it. Even before a product gets to the market, we look at the data or what studies have been done. Can a condom actually do what it's supposed to do? That sounds very simple, but for a regulator, it is my primary goal to ensure that that condom that you're seeking to bring to the Kenyan public actually does what it needs to do. I do wear several hats. I have gone to manufacturing facilities. And just for you to understand the length as regulators we go to ensure that these products before they come to the market are actually assured, is we go to those facilities manufacturing condoms. We must look at the quality systems in place. We must work with UNFPA because UNFPA conducts pre-qualification of manufacturers. That information is what I'll use to say that this manufacturer can bring this product to the market. And we have many products that come through the Government of Kenya program, and that is one way to assure. But that's not enough. Even when the product is in the market, we are constantly conducting surveillance, inspectorate, we remove products from the market. Counterfeiting of condoms is something that is well known. And then we also have neighbors. Our products can come from our neighbors unbeknown to us. So as a country, we have a very rigorous regulatory system. We have products that are tracked across, and we know that when there's a shortage, we are also at the front of ensuring that the manufacturers are aware and that we can get, and where there's a problem, we are quick to act and to remove those products from the market. I don't know whether that can be a beginning session.
Yeah, thank you.
Thank you.
Thank you very much. That was a very good, you can pass the mic to Dr. Okwaro. Yes. The next question is around the effect of condom stockout on the disease burden. As I know, as a public health specialist and a gynecologist, what's your take on that?
Yes, thanks, Tom. Good afternoon once again to all, to the audience. First of all, let me just get back into a question that Ruth had asked when was faced with her daughter or son about what is a condom. Just this is personal also. When I was in Form 1, I think I encountered a condom in a house. During the school holidays, I usually sometimes do this organizing, making the place look good. And I encountered a condom in the drawer. And actually, when I gave my dad, I say, "What is this?" Then he quickly just picked it from my hand and said, "You will know it later." And indeed, I came to know it, and now I'm working in it. Yes, so issue of one is to say, the issue of the condom shortage. Indeed, Madam CEO, Dr. Ruth has already highlighted on what condoms we get used in. And we see the challenge that we have, first of all, in making it available. And looks like globally, and even within the East African region, and more specifically even Kenya, when you look at even the strategic plan for the condoms, was to move it from around 42% to up to 80%. And a similar study, when looking at the analysis from the East and Southern Africa, and even with the UNAIDS report of 2018, the gap still at 50% needs versus against the supply. And therefore what it means is that we still do not meet the HIV prevention needs. We don't meet the STI prevention needs. We don't meet the unintended pregnancy needs. We very well know the effects of when STI which is not treated, because we get to know that many of the infertility cases, let me look from the gynecological perspective first before we even go to the HIV. 85% of the infertility could be because of those STIs that have been acquired and go untreated. And to that extent means that we expose the girls and the couples, for that matter, the ladies, to a situation of infertility. And that management, of course, becomes very expensive. We do note that also right now, very well known, and Ruth has shared with us the charts on the supplies, 70% from the public sector. And even when we look at what we call the national FP annual supply plan for the family planning, it's also anticipated that about 70% of the condoms which are going to be used for as contraceptives still come from the public sector. And what we need to see is that the unmet need for family planning in respect to condoms is going to be huge. And therefore, we need just to address that. I also want to look at the aspect of the condoms availability in physical sense, but then not availability in terms of effectiveness. Some of the facilities when we visited 2 years ago, we found where they place the condoms, where they are being, because they are in huge volumes, maybe storage facility is not there, they're put on the floor. Some, actually, the one which was worse was when it is put on this, the makeshift houses when you're constructing a building, the mabati. So the heat which is there, the condoms are heaped there. For sure, those condoms are not going to be effective. It's just like you don't have condoms in that particular place. So we end up exposing the people who would have thought that they're using condoms and then end up not using condoms. And what Stanley was talking about, the king, in terms of the breakages. So in a nutshell, we end up having the stockouts, and it is very, very common. And when there's stock out of condoms, I get the issue one, especially for the female condom, because UNFPA is almost like the sole procurer of female condoms. I'll get a first call. So the many calls will come. So one of the, when you get to know that there's a problem, you get those calls that, where is the female condoms? Where are the male condoms? And the challenge is for us now to make those available, because indeed, I believe there's someone who's going to talk about it in terms of how do we make it easier, how do we make it cheaper for the community to access the condoms. Thank you.
Thank you very much. Actually, you moved me to the second question that I was about to ask. How can we make them more affordable, accessible? Anybody can answer to that? Can pass the mic? Let's hear from the counties first.
Thank you very much, colleagues. This is quite an interesting discussion. The topic, condom. One single intervention that can take care of 3 problems. That is HIV infection, STIs, and of course, pregnancy. We must be realistic. These are the big problems that we have. And every county is talking about teenage pregnancy, new infections everywhere for HIV. We need to be candid with ourselves. And just to ride on what Dr. from PPB said, our domestic financing. Dr. Maisha said that condom is not even part of the essential medicines or essential supplies. The same regulator, we as a country, we've agreed that we have a problem. So you have all the powers. You have all the powers to change this device to a normal supply, because latex is latex from where I stand, and even gloves are latex, and gloves are classified in the group of essential supplies. So if condom can be redefined that way, then we'll be able to get out of that tax bracket, and of course it will be cheaper, affordable to all our people. So these are discussions that we need to be very open with Treasury and all of us, so that at least we help this country. Then the other thing is we need to see how can we do proper quantifications, even at county level. Can every county know how much of condom do they need? Can we cost it so that we know this is how much we might need if one day we become sane enough to put it in as part of essential supplies? And this goes along with the, you realize that most of the condoms that are supplied reach the dispensaries. How can we use the community strategy to ensure that condoms can reach the households? If the population needs to use the condom and the dispensaries are always closed at night, so where do they go? That's a very big question that we need to talk about. Then the other thing is social marketing. We need to see how do we ensure that one, as a country, this needs a lot of political goodwill. Can we manufacture this in the country? Can we have local manufacturing so that at least we can have availability and accessibility as easy as possible to the population? Thank you.
Go ahead, Dr.
Thank you very much. I want to build on to what Dr. Gordon has talked about. And is about sustainability and availability and sustainability of the condoms. And he has touched on two areas, social marketing and free for distribution. And I'm particularly impressed with the point of thinking that can we use the latex as the base to decide that these items are based on the latex, and therefore we can classify them, looking at the benefits to the country, aware that looking at the amount of money we are going to spend in this or the tax foregone, we look at it as an investment, as a seed that the country is putting to the ground to benefit a lot from averted unplanned pregnancies, particularly the teenage pregnancies, but even in families. Unwanted pregnancy can break a family and cause untold suffering to the children and beyond. In addition to this, the investment, the benefits that the country is going to reap in averted STI infections, they cost this country. The other thing is on the new infections. A new infection translates to about, now with the way the dollar is going, and Dr. Okoro was advising me, we need to start putting our budgets in dollars, because you put in shillings and then when you go to buy what you wanted to buy, it's already moved. So we're looking at almost, it will be something between 25 and 30,000 for medication only per new infection for the lifetime. A young man is infected and when he's 20 years old, or a young girl is infected when she's 15. She's going to live to be 60, 70. All those years multiplied by 30,000 just because they couldn't get the condom. So the payoff, we can't even argue about the payoff. We should just be arguing on how to implement, because we are convinced that the payoff is, a condom is such an important investment. And the view that we've been talking about, and Dr. Maisha already alluded to it, is we look in the total market approach. Taxes are good, they're important for our development. So we can reclass and say, the following condoms, when you consider it a premium, then the government can recover its full taxes. Socially marketed, we need to bring we have to bring some kind of price control by giving them concession on either removing the entire tax or putting such a little tax such that the majority of Kenyans can be able to buy. Now, we like variety. Every human being will like choice. Variety so that we can be able to buy something that's of value. But we know, even Christ said, among you, there will always be the poor. So, and they're not poor all the time. So we must have maybe like 25 to 30%, no more than 40% as part of our free for distribution. And this free for distribution, a lot of them there is bought by government, they're bought by funders, PEPFAR, Global Fund, another donation. Those ones should be tax-free so that they are free for distribution. They're cheapest available, because all of us passing through stage, you're student one, you are down on your finances, and you need somebody to shoot on. That's the total market approach, and I think that's what makes the difference between Nigeria and Kenya. That's why they are social marketed condom. They are very well priced, because they are not exposed to the same level of taxation as a premium condom, and as a result, a lot of people are able to buy. and therefore the burden on the government to buy condoms gradually disappears. Thank you.
I would like to pause this session a bit. We are going live on K24, so we need to rearrange. Then from there, we'll continue with the discussion, the same discussion. So, Dr. we'll begin with you once they set in. Okay.
What's the setup? That's it. Osman. Okay. And this one? Okay. There is.
Tunajipanga sasa hivi tunamaliza tu.
Somo. They want this discussion. We just manage it. Yeah. So and dilute the quality of my discussion for purposes of live streaming, with all due respect. So when we have people doing sit-ins, and that's a policy maker, I'd rather not be on television, but have this discussion. Yeah, I think you It's can not that
all the
important for me.
one question so that everything is captured. We have something like that. Mama, can we have one? That's fine.
We can add one more. Attention.
kifupi waweze kutujuza mikakati ipi ambayo inawekwa kutoka kwa serikali na vile vile wadau mbalimbali pia ambao wanahusika katika sekta hii kuhakikisha kwamba watu wanaishi na virusi. Lakini kama ni nchini basi nayo yanaangaziwa. Kwanza na Daktari Maisha ambaye ni mkurugenzi mkuu katika Baraza la Kitaifa linalodhibiti maambukizi ya ukimwi na magonjwa mengine ya kuambukizwa. Daktari Maisha, karibu sana. Tujuze tu kwa kifupi, tumekuwa tukiangazia masuala ya mipira ya kondomu. Mara nyingi Wakenya wanasema wanakwenda pale dukani mipira ya kondomu haipo, lakini tunapoendelea na mafunzo tunasikia kwamba huenda mipira ipo lakini watu hawanunui na hawatumii mipira ya kondomu. Ni ukweli ama ni vipi? Karibu sana. Naam.
Asante sana.
Unaweza ukazungumza na Kiswahili la kidogo kuchanganya na Kizungu.
So leo tuko hapa tukiongea kuhusu condoms, na condoms ni njia moja ile tunatumia kwa vifaa za kuzuia ugonjwa na ugonjwa wa ukimwi. Pia condom inasaidia kukinga na mimba ile wataki, na pia so leo tulikuwa tunaongea kuhusu ile tunaita total market approach. Tunajiuliza, je, tuko na condom tosha kuishi? Sana sana tusema hivyo, watu wanauliza zile condom zenye hazibiki tunazita free to use, ama pale mtu akienda dukani ama akienda hospitalini ama. Alafu tunajiuliza, je, hata kama condom ziko zinatumika na kama hazitumiki kwa nini? Jambo lingine tunajiuliza ni kwamba kuna condom zinatoka kwa hali zingine kama vile wale wanauza, pia hizo zinatumika, watu wananunua hizo condoms, na kama wanunui, kwa nini wanunui? Kwa hivyo tunataka kumaliza hii session tuwe tunaweza kusema nini hasa tutafanya, tusaidiane wananchi na serikali na kuwa condom iwe ni ile tunaita essential tool, na wale watu wanafanya ngono na wale wanafanya ngono wakati kuzuia maradhi. Nchini Kenya tunahitaji condom 404 million za wanaume, alafu za wamama tunahitaji condom karibu 8. Lakini kama kwa mfano mwaka wa 2022 tuliweza kupatiana 120 million na serikali za wanaume na zingine 3 za wamama. Na hiyo imekuwa shida kwa sababu condom zile zinaweza peana za bure, watu wanasema hazitoshi. Kweli hazitoshi kwa sababu ile tuko nayo kidogo kweli. Kwa sababu gani? Kwa sababu kwa muda mrefu tumekuwa kama nchi tunaangalia wale wadhamini walikuja kutusaidia na hii maneno ya HIV, watusaidie pia na maneno ya condom. Na ile tumekuwa tunaendelea, zile nchi pia wako na masharti zao, na pia sisi kama nchi ya Kenya tumekuwa tukipanda ile tunaita ekonomi yetu imekuwa ikipanda. Kwa hivyo zile pesa zilikuwa zinakuja zikiwa kama grant imeanza kutoka. Na kwa hivyo kama nchi tunajiangalia, tunasema tutafanya nini sasa ndio tuweze kujaza ile pengo la fedha za condoms. Na tutaangazia maneno pia, tutajiuliza, je, kwa nini kama condoms ziko watu watumie? Ndio swali tuko nalo hapo, wale tuko nao tunaongea, tunazungumza, ndio tukitoka hapa ile strategy tutaweka tuwe tumeangalia au maneno yote 3 tuweze kuendelea.
Asante Daktari Maisha. Bila shaka kwa upande wako wa kulia tulikuwa tumezungumza kidogo, Daktari Pauline alikuwa amezungumza akasema kwamba kondomu ziko, lakini je, hizi kondomu ambazo ziko mara nyingi vijana wanasema wanapotumia mipira hii huwa inapasuka. Anasema huenda ile hali ambayo hizi kondomu zinawekwa ama ile mpira ambayo inapatikana nchini Kenya sio hali nzuri ya kuweza kutumika na kuwakinga watu wanapotumia mipira hii. Kwa hivyo Pauline, utaweza kutujuza, je, ni kwa sababu mipira hii ile ambayo tunaita quality yake sio nzuri, ama ni kwa nini mipira hii ambayo iko inayopatikana haiwasaidii vijana katika kujikinga na watu ambao labda wanajihusisha katika vitendo vya
Shukran sana na changia radhi naomba nizungumze Kiingereza ili niweze ku so especially in order to assure the public that the regulatory system bringing up that the cost of education as we see condoms is very massive and do respond to marketing from manufacturers.
Na mtazamaji, bila shaka kwa kuendelea na mazungumzo haya, ni muhimu tu tujue kwamba zipo kaunti ambazo zimeripotiwa kuwa na idadi kubwa zaidi ya watu wanaoishi na virusi vya ukimwi, Homa Bay ikiwa ni moja yao. Na bila shaka wapo wawakilishi ambao pia watakuwa wanazungumzia kwamba katika kaunti hizi ni vipi maambukizi haya yako juu, ni visa vipi ambavyo vinachangia mambo haya ama maambukizi kuwa juu zaidi. Kwa hivyo niruhusu nizungumze na Daktari Gordon. Alikuwa amesema kwamba kuangalia tu kaunti hizi, zile mipira ya kondomu inapeanwa katika kaunti tofauti kupitia wizara mbalimbali husika, na ni kwa nini kwamba zipo ama yapo maeneo humu nchini ambayo bado hayapati kondomu za kutosha ili kuhakikisha kwamba wale watu ambao wanahitaji basi wanaweza kukingwa ipasavyo. Daktari Gordon, ulikuwa umesema kwamba ipo haja ya kuhakikisha kwamba ile mipira ya kondomu ambayo inapeanwa katika maeneo haya, basi idadi ya watu katika maeneo haya basi pia ni lazima. Tueleze kusema.
Ladies and gentlemen, I said earlier that fine, as much as Homa Bay has out there the highest burden of HIV in the country, we're not shying away to bring other issues that can bring the spread down. And condom is one of the combination intervention in bringing down the spread. And we just see from this discussion that it's one intervention that can sort of three problems. That is new HIV infection, teenage pregnancies or pregnancies as a whole, and of course sexual transmitted. So we know very well that the national government does supply collaboration with the government, and more of this is actually done by the government in terms of procurement as national games. But we realize that the distribution reaches out to this extent. I gave an example of if people want to use the condoms at night, where they, so that way all of us can put our heads together and see into it that communities can get this paper to support this riding on the community health units and the community health strategy insurance. This when they also working now, it becomes part of the essential packages that they supply also at household.
Na bila shaka tunapozungumzia kwamba idadi ya watu katika maeneo tofauti, basi kunao ambao kaunti ina watu wengi kushinda wengine, ikizingatiwa kwamba sio rahisi kupata watu tofauti ambao wanataka kutumia mipira hii wakipata vifaa hivi. Na hivyo basi tunapozungumzia hayo yote, shirika la AHF bila shaka kwa muda mrefu limekuwa likiagiza mipira hii ya kondomu kutoka nchi nyingine na kuzileta hapa nchini. Lakini wanapofika hapa, serikali pia inatoza ushuru kondomu hizi. Lakini tunauliza swali, ni vizuri kwa serikali kuweza kutoza ushuru vifaa kama hivi ama kutoza ushuru mipira ya kondomu ambayo inapofika humu nchini inapeana kwa Wakenya kwa bure kabisa waweze kujikinga dhidi ya maambukizi ya ukimwi? Daktari Samuel Kinyanjui anaweza tu kuzungumzia swala hilo na kuagiza mipira ya kondomu kutoka nchi zingine inapofika hapa Wakenya wanaikosa, kwa sababu lazima inatoza ushuru kwa njia moja au nyingine, lakini Wakenya inabidi wanunue ama wanaikosa.
Asante sana kwa nafasi hii. Niseme kwamba shirika la AIDS Healthcare Foundation hapa Kenya tumekuwa tukiimport condom kama milioni 5, miaka mingine milioni 10, na condom hizi icon na lab condom huwa tunazileta kufanya ile inaitwa free distribution ama free to use. Kwa hivyo mtumizi hana haja ya kununua. Sana sana huwa tunawalenga wanaohitaji kujua sana katika jamii. Kule kwenye colleges tunaangalia watu wanaoishi kwa mitaa ambayo tunajua informal settlement, mitaa ya mabanda na watu wengine ambao uhitaji wao chini. Lakini kupitia mwaka wa 2020 tumeshindwa kuendelea kuleta kuleta condom kwa sababu ya riba hii ambayo tax ambayo serikali inaitisha. Wafadhili walisema wanashindwa kununua condom, ship na kuleta hapa distribute, na serikali pia inaitisha riba. Na kwa hivyo ombi lao kubwa na ombi najua la wafadhili wengine ni kwamba tax hii iweze kuondolewa ili kuokoa maisha ya Wakenya wetu. Kwa kwamba kila Mkenya ambaye anaambukizwa na ugonjwa na virusi hivi vya ukimwi, serikali itawagharimu kati ya shilingi takriban 25,000 kwa mwaka kununua dawa tu kwa maisha ya mhusika. Kwa hivyo condom ni bei ya chini sana, kwa kwamba condom moja ni kama kwa free for distribution unaweza kuleta na kama shilingi 20-30. Tuseme kwa dola ya sasa hata kusonga sana shilingi 50. Shilingi 50 ukipiga hesabu na kumpea na maisha ya mtu kulipwa serikali hitaji 30 kila mwaka, bei sana. Na kwa hivyo tunaomba tuangalie market ile inaitwa total market approach na kubaliana nao. Kuna watu miongoni mwetu wanaweza kujimudu, kwa hivyo wanaweza, lakini kuna watu ambao hawawezi kujimudu, wanahitaji virutubishi. Na kuna condom ambazo kuna watu wastani wa uwezo, na kwa hivyo serikali inaweza tunauliza kama serikali inaweza kupunguza tax kabisa, kwa hivyo ili tuweze kufanya ile social marketing. Condom kuwe nzuri, kuwe variety ipo, lakini bei yake ya nafuu. Asante.
Naam, hata tunapozungumzia bei ya mipira ya kondomu na hata tunapozungumzia mambo mengine, ni muhimu kujua serikali ama wadau mbalimbali ambao wanahusika wamekuja pamoja kuweza kufunza jamii ama kuhamasisha jamii kuhusiana na mipira hii, ni vipi wanaweza kuitumia. Wengine tunasikia mipira hii mengine inapasuka. Basi labda tukizungumza tu na mmoja wa ambao wamekuwa wakizungumza siku ya leo, atuulize ni mikakati ipi ambayo inawekwa kuweza kuhamasisha jamii zaidi na kuhamasisha mzazi kidogo, atueleze mafunzo yanaendelea katika tayari na tendo la ndoa katika jinsi ya kutumia mipira hii ili waweze
jaribu zile tunajua tunafanya kwa serikali. Tunajua serikali ina very good policy, very good strategies and very clear implementation strategies on use of condoms. Condoms is able to demonstrate and all these strategies are there. And what we are saying is that the strategies are very critical for condoms. But that will not the issue. If you have these condoms available, can create demand for what is not. So the bigger issue here, not we have to educate because we are educating and that's we don't have the question. This chooses educating all the peers we are talking about part of it. But what we are seeing currently is that the challenges we are having now is that these condoms are available. These are available for free. You know, they say that condoms is equal to amount. But as the users of condoms, are not patients. So we must think beyond the facility, what he said. So the people who are accessing it is free to access. So the patient is not educated on the use. You can limit them available. Once we support that life, to the person, where can we work? In the village is there. You go to a retail shop, you get a condom. Because in cities, you can go to the supermarket. What is a farmer's shop? You go to Machinani, where can you access it?
Asante sana. Bila shaka sijazungumza na mmoja pale alikuwa pale kesho kidogo, na ningetaka atueleze. Daktari Maisha alikuwa anatupa story hapa akisema kwamba wakati ambapo yuko pale nyumbani, wenda mtoto anapokuuliza mpira wa kondomu ama kipata pale anapocheza, akutane nayo akuulize swali, hii ni nini? Utamjibu nini? Wazazi wengi huwa hawajibu kwa swali hili, na inakuwa vigumu sana kuweza kumwelezea mtoto hii ni nini. Wakati ambapo mtoto anauliza maswali kama haya, ni umri gani ambao unapaswa kufika anaweza kuelezewa na akaelewa mpira wa kondomu ni nini, ama masuala yanayozungumziwa kuhusiana na swala zima la maambukizi ya ukimwi yanapaswa kuzungumziwa kwa wakati gani? Maanake pale shuleni siku hizi kidogo tunaona hata walimu wamelegea kidogo kufunza watoto kuhusiana na swala zima la mambo ya labda kujihusisha na tendo la ndoa kwa mapema, na hata mipira ya kondomu haizungumziwi kwa uwazi katika jamii zetu za Kiafrika. Sijui kwa muonekano wako unaona ni vipi tunaweza kuwajumuisha wazazi na watoto katika kuzungumzia swala zima la maambukizi ya virusi vya ukimwi na vile vile matumizi ya mpira wa kondomu?
Asante sana. Tukisema ningependa kusema kuwa ni vizuri kujua utunzi wa mpira na pia kuwa na habari ambayo inafaa sahihi, kwa sababu mtu asipopata habari sahihi ama kielezo ambayo inafaa huenda kusema apate kwa njia nyingine ambayo ataleta jamii kwa jumla, wapate maelezo kutoka kwa wengine kama wafanyakazi wa afya ama ambao wanafanya kuelimisha wananchi kwa kumili, pia wanaweza kupata maelezo hapa na vizuri. Wakati huo mtoto amekuuliza swali, kuna vile utamjibu kulingana na umri wake. Sio lazima usimfukuze ama ukataze kumweleza vizuri, kwa sababu usipomweleza vizuri huenda atatafuta hiyo jambo mahali pengine ambayo haijafaa. So ni vizuri kupata maelezo kamili, na pia mwenye kumweleza pia lazima ajue awe amejua chenye anafaa kumweleza hiyo mtoto ama kuuliza swali.
Naam, bila shaka ningependa Daktari Maisha afunge kikao hiki kabla sijazungumza na mtu ambaye anajitakimu mkono, na itakuwa vizuri nikimaliza kikao hiki bila kuzungumza naye. Daktari Maisha, kwa dakika 2 hivi, usia wako ni nini? Kongamano linaendelea ndio, na wadau mbalimbali wa Kenya katika labda kaunti tofauti wanataka kuelewa ni vipi ama ni mikakati ipi inayowekwa hata baada ya kongamano hili kuhakikisha kwamba Wakenya wanapata vifaa hivi na hata vingine ambavyo tunahusika katika kuhakikisha kwamba maambukizi ya ukimwi na magonjwa mengine ya kuambukizwa yanakoma humu nchini.
Asante sana. Mwisho wa kongamano tunataka kuwa na suluhisho kwa sababu hili janga la ukimwi tulikuwa miaka sisi wote wananchi, serikali, wadau, vijana na hata sana ya wale watu ukimwi wamekuwa safari mbele kabisa kusaidia kumaliza hii kongamano hapa nchini ripoti, kwa sababu tunasikia mengi sana angalia zile nazo fedha nasikia hapa kama leta hapa kana naweza kusema kama jambo tena yetu bodi ziko nazo jana tutajiki tena tuko na kazi hapa na tutaangalia tuone nini hasa kama hivi. Shida ziko mingi, lakini
Naam, bila shaka ni Dr. Maisha alikuwa akizungumzia na atakuwa anaendelea na kongamano. Kongamano halijaisha, inaisha siku ya kesho, ambapo wadau mbalimbali wamejumuika kuhakikisha kwamba mikakati inawekwa kukomesha maambukizi ya virusi vya ukimwi, sio tu kutumia mipira ya kondomu, lakini pia kuhakikisha hata watoto wanaozaliwa wanakingwa dhidi ya kupata virusi vya ukimwi. Karibu sana. Huyu anajiita King of Condom humu nchini. Amekuwa akizungumzia sana masuala ya mpira ya kondomu kote nchini. Wito wako ni tafadhali, wapo watoto wanatazama, kwa hivyo kuna mambo mengine tutaonyesha baadaye, lakini kwa sasa labda itakuwaje? Zungumza, wakubwa wamezungumza, wadau mbalimbali wamezungumza, wewe ni mdau pia katika sekta hii. Usia wako ni
kwamba kuna vijana ambao maambukizi mapya ya vijana
sana, na ambapo vijana condom hizi to access condom. Mwenzangu amesema condom kuwekwa kwa hospitali na wagonjwa hizi kutumia condom waweze kuchukua nje, vijana waweze kuafford condom na waweze kupata kwa rahisi, ambapo wengi ndio walipiga kura juzi waweza kuvote. Hapo we need to protect that generation kwa kulinda mapema, tuweze kulinda mali safi. Au vijana ni mali safi wetu, kwa pombe, kwa drugs, kwa HIV, kwa crime, tuweze kushikana pamoja, tuweze kuprotect that generation, ili hiyo generation is protect kuja kwa wazee. Ni jukumu yetu ambao tuko hapa sasa hivi, tuweze kufanya lolote tuweze fanya, tuweze kuacha aibu, tuweze kuambia ukweli, because what the father, what the teacher, what the doctor cannot say, the king and the team here will tell the children the truth themselves.
Shukrani sana. Bila shaka studio ni mazungumzo tu yakiwa yanaendelea kuhusiana na maambukizi ya ukimwi kote nchini. Jitihada ni zipi ambazo zinawekwa kukomesha maambukizi haya katika nchi ya Kenya? Inadaiwa kwamba ifikapo mwaka 2030 maambukizi haya yatakuwa yamekoma. Hizi ni mikakati tu, baadhi ya mikakati ambayo inawekwa kuhakikisha kwamba ndoto hiyo inaweza kuafikiwa. Busara Nama, nitaniruhusu tu nirejeshe kwako studioni, mazungumzo yanaendelea. Tukimaliza basi tutaleta ujumbe pale nje, ili wewe Mkenya unayetazama pia uweze kujua ni vipi unaweza kukinga na kukinga wale wapendao. Busara, niruhusu nirejeshe kwako.
Yeah, okay. So can we wrap up? We are wrapping up. Panelists, you can go back. Yes.
I'll just give you as I wrap up. I'll just put it. Okay. The two of them at the left.
So ladies and gentlemen, we are winding up. Hello? We have less than 10 minutes. Can we wind up? Okay. So, so we're going to wind up. Just before that, Dr. Kimu.
Okay. I was to mention a bit on financing for condoms. We know it is obvious. It is obvious that that we have a challenge. I don't know whether it is myself alone. There was a time I had there was a report that there was somewhere in a community somewhere where they were using condoms. I don't know if I was the one who had. Is there anybody who had? People who are watching condoms, putting on the sun and using. That describes what we are trying to say here, that it is obvious we have a challenge. The issue is that do we have enough condoms in the country? Now, what was shown here by Dr. Macha is that, we are relying on public sector donor-funded condoms, largely. That if UNFPA, Global Fund, USAID were to withdraw, then we may not have condoms in this country. And that's the issue.
So in a section like this, it's important to start the thinking now. Do we remain dependent like that? What can be done? And solutions have been floated here. We know that wherever we live, there are people who can afford to buy condoms. Can they be made available? That means, in terms of financing, that's a private sector financing. Can we make them be available? So that wherever they are working, they can buy to a price they can afford. But do you get them? Do you get condoms in everywhere you go? I know if somebody was to do a survey to look at the quantities in the market, in the private sector, there may just be too few. Then there are population groups who cannot afford. Can we target that one with the budgets that we're talking about here? And you know the government has a huge budget. The government, this financial year's budget is 3.6 trillion, if I remember well. Does it mean that in the programming of that budget, we don't think about, we don't prioritize a life-saving commodity? Out of the 3.6 trillion, why don't you just put some 1 billion there and we deal with our gap? I'm sure the 3.6 trillion will still be 3.59 trillion. That's the national budget. At the county level, is another budgeting places where they can prioritize. Is there anybody thinking about it? So if we are a bit focused, and we follow because in the government, when we are doing budget, it's not from nowhere. It's something we call program-based budgeting. If we want to deal with the three conditions, STI, HIV, pregnancies, in program-based budgeting need to be defined by the technical experts. And we put resources there, and the budget comes from there. It's prioritized there. So if we are really focused, we can actually get enough funding for free condoms. And then we define the outlets where they can be. We go beyond health facilities. We have been in the health sector for long. It's not unusual to see condoms expiring in a big hospital somewhere, boxes in somewhere. It's not unusual. It's not that they are not needed. It's that we don't think beyond how do they move from there to go out. So the people in service delivery need to rethink. And we are talking about counties here, to rethink about either in a hospital, how do they go out. So in terms of public financing, it needs to be prioritized. And I think there's a time. We know that donor funding continues reducing. Last year we had a big crisis when there was a reduction in donor funding, and all of a sudden we didn't have anything. So it's a reality, and we are being told on and off. Now in the middle, there's a population group which can afford but not the very expensive. These are the kind of subsidized or social marketed condoms which can be made available. The government puts maybe some 40%, and you put the 60%, you got the condom. So what we need in condom programming is a focus and deal with it, because it may not be an issue of financing. Yeah. And I'm sure somebody will talk about the private kind of investment and how it can be done, so that the ones who want to buy can buy anything. Condoms, even, they are not always latex. There are other types of condoms all over, so that anybody can even choose what he wants. So we don't see a problem of funding. What we see is a problem of prioritization. Dr. Maisha, I think that's how we see it from Treasury. That's why I am. We see it because we fight budgets which are buying many things, but because these items are not there.
I see Dr. Maisha is smiling, and Kimu ameongea, Daktari Kimu ameongelea Daktari Maisha juu ya budget na budget-based programming. So now, ladies and gentlemen, I know we've had a few segments, and can you have a clap for my co-moderator here? Hey, you do clap. Unajua, I learned something from Stan. I asked by the way, let me ask one more time. How many people here have ever been a peer educator? Nione tu mikono. Dr. Kumu, you are a peer educator. Don't be shy. Sasa, even if you go to a club. See, this is one of those tuna mobilize. So mimi nataka ile makofi ya Nyayo. Mnakumbuka ya Nyayo? For those ones, if you are 40 and above, you know this one. Sasa makofi ya Nyayo. 1, 2, 3, funga, fungua. Asanteni. Alafu mnatingiza baadaye. Lakini kutingiza inaweza mean something else in this forum, so sitasema hiyo. Now that I have you smiling, I would like to open it up for a few folks. I've seen some folks who have walked in. I want to recognize our very good friend. I'll have him introduce himself and say hello. Unajua saa zingine watu wanaingia kwa room na hujui nani ameingia. But front seat hapo umekaa karibu na Condom King. So if it's okay, if you allow us, we would like to hear your voice.
Well, good morning, ladies and gentlemen. All protocols observed. It's afternoon, sorry. Good afternoon. Yeah, my apologies. My name is Elias Meli. I'm the CEO, National Cancer Institute of Kenya, and I'm happy to be with you this afternoon. My apologies, I came in late due to other commitments in the office and commitments of the office that I do occupy, but I'll be with us until the end of the conference. Thank you very much.
Karibu daktari. He's also a professor.
Yeah, so this afternoon we have a session which the National Cancer Institute of Kenya is going to moderate, and we would be very happy to invite you. Our topic, if you look at the program, is how we are integrating, how the integration of HIV, HPV, and cervical cancer. And these triplets that we have to address them jointly if we have to eliminate cervical cancer by 2030, as per the WHO call of 90, 70, 90 WHO call towards elimination of cervical cancer. If you want, begins at 2 in this same room. I'm guided. Kindly, please let us discuss, let us educate, let us inform, and let us collaborate. This is one disease that affects all of us. You are either affected directly or indirectly. And I want to believe through the blessings of our CEO, appreciate, and we are grateful that we had this opportunity to partner with the NSDCC as we consider this very important topic. Thank you.
Karibu sana, Prof. Now he's a professor and a doctor.